recently posted about health insurance companies being the sort of evil empire of medicine in the United States. And they are evil. Companies like UnitedHealthcare make their money off the backs of patients like you and doctors like me. They're basically chewing from both ends of the bread loaf to fill their pockets and leaving, patients wanting more and doctors wanting more. Now, that kind of brings me to the thoughts and the arguments circulating around universal health care or Medicare for all, or any way you want to put it. And interestingly, I was texting with one of my buddies, or a couple of my buddies who are doctors, and the more I think about it, the more I believe that some kind of universal health care option or Medicare for all is really the only answer, because insurance companies are the problem. So I'm going to give you sort of an example. I'm going to get a little deep here, but I want you to understand what's going on with private insurance companies. So the way private insurance companies gauge their reimbursements to doctors is it's at a percentage of what Medicare generally reimburses. So say UnitedHealthcare, which is one of the worst plans in my opinion, says we're going to reimburse at 30% of what Medicare reimburses. So if Medicare pays a doctor $100, UnitedHealthcare pays a doctor $30. Now, there's $70 there. There's a $70 difference between what Medicare pays and what UnitedHealthcare pays. Well, guess what happens with that $70? It goes into the pockets of UnitedHealthcare. It lines the salaries of their CEO, who made $18.1 million last year. It's a purely profit-generating scheme by taking money from patients' premiums and not using it to pay for their health care, and also not using it to pay doctors after they've already been seen, after the patient's already been seen. So it's a really broken system. Medicare is the only insurance company that doesn't do that. You basically see a patient, you submit your charges, you know what you're going to get paid, and you get paid. Done. There's a small administrative fee that's removed for whoever's processing those claims, but it's an efficient, well-run system. Now, there's all of these arguments that medicine is our medicine in the United States is so sophisticated because of the pharmaceutical companies and the private health insurers. Let me tell you, the private health insurers have nothing to do with that. We will still be the best healthcare system in the world. We'll still be able to offer the most sophisticated operations and the most sophisticated treatments. The difference is you'll have access to them. Everyone will have access to them. If we eliminate private health insurance plans, there'll just be a lot more money floating around to take care of patients and to pay doctors for the services they rendered, rather than lining the pockets of CEOs of all of the private health insurance plans who make millions upon millions upon millions of dollars a year. Their administrative fees for running these insurance companies is insanely tremendous. If every one of those dollars went to take care of patients, we wouldn't have a problem with healthcare in this country. So that's my take. The other thing I do want to say is in one of these texts I was having with my buddies, he said, you're really feeling the burn, feeling the burn like Bernie Sanders. Listen, I have no political affiliation. I think Bernie Sanders' ideas to make healthcare available to everybody, I think is amazing. But on the flip side, I also think what makes America so great is folks are able to become billionaires, like the Jeff Bezoses of the world, or the Mark Zuckerbergs of the world. These are folks who are brilliant, they're innovators, they're making amazing change to the world. They deserve to make money for being innovative. I don't think we need to tax all the billionaires and all the other stuff that frequently goes along with anyone who supports universal health care. I'm as much of a capitalist as anybody. I think what makes America is great, and what makes America the best country in the world to live in, is because innovation is supported and innovation is rewarded. But that doesn't mean healthcare shouldn't be universal or can't be universal. The problem is patently obvious. The private health insurers are the problem. UnitedHealthcare, Blue Cross Blue Shield, Cigna, all of the private plans. That's where the problem is. Let's get it.